Hello, everybody. I am going live today to try to touch on a topic that I think will help a lot of families who are newly pregnant and trying to decide what is the birth that they want. Um, I know that home births are on the rise, yay, but it's still a very small percentage of women who birth at home in the United States. So I think it's important to discuss why it might be an option. Why are women doing it? Besides the fact that we've been doing it for hundreds and hundreds of years, but why is there a rebirth of it, so to say? And I think it's important to at least understand the option. I know that home birth or maybe a birthing center birth is not necessarily for everybody. And I think there's two different ways and reasons to come to that conclusion, right? The first one is personally, what are you looking for in a birth? How are you envisioning your birth? Where are you feeling safe? And then I think another completely different angle to question it is, am I a risk factor? Am I low risk? Am I high risk? Health wise, am I okay to think of doing a home birth? So answering the same question, but in two completely different views. So let's talk about each one briefly. I know for a lot of women, the idea of labor is scary. It seems really painful, and they just are scared and they want drugs so that, or at least the option, so that if it gets too intense, they can tap out and everybody's right there, which is fine. But I think understanding that, where you are birthing, what you are doing in your labor can really play in to if it's going to be the scary vision that you have or not. So, getting the right environment for the birth that you want is extremely important, and it will help to deal with that common fear. If you are laying down in a room that's very unfamiliar to you, very cold and scary, then sure, then all the discomforts you're feeling are going to be heightened. If you are in an environment where it's your room, it's your bed, it's everything that you're familiar with, your family members that you're familiar with, all familiar faces, you're able to move and go into the tub, then likely the fear isn't going to be as intense, or sorry, the pain isn't going to be as intense because you're coping with it. Where in the other situation, you may not be able to cope with it how we usually cope with pain. So that's one thing I think it's important to consider if you want to do a home birth. What do you do when you're uncomfortable? When you have really strong menstrual cramps? When you don't feel good? What do you do? And seeing if setting up that environment is possible in a hospital, then great. If it's not and it's better for you at home, then that should be an option that you look into. I also think that, support is really important for your birth plan. So when you come up with your birth plan, do you see your team being supportive in the hospital? If you want delayed cord clamping, if you want immediate skin to skin, if you want no one touching your baby, if you want dim lights, music playing, do you see that being something that your birth team can do in a hospital, or are they limited because they're really prepared for more emergency settings? Is that maybe something that we shouldn't be going to the hospital for, because the type of birth I'm looking for is not something that they can give me. So I don't go to a car dealer for, a house. They can't do it there. It's not possible. So I think these ideas of having these births are great, but you also need to make sure that the location that you are doing it in supports that and can support that. I think everybody wants to be able to do it, but if they're not capable, whether it's policies or beliefs, then it's just not the right place for you. Another thing to look into is, medical wise, right? So obviously, if you are wanting to do a home birth and you have some health factors that are, uh, increase your risk factor, then no, home birth may not be the wisest choice for you. You may be better off in the hospital, so that because of these health issues, if it leads into a bigger problem, then you are already in a facility that can support that. Whereas low risk women, which is what home births are designed for, is low risk women, right? It's better for you to be at home. It's better for you to have less intervention. It is better for your body to go through the normal process of labor and birth at home when you are healthy. To go to a facility that is equipped to handle emergencies for a healthy, low risk may not be conducive to the birth outcome that you are looking for. So you always want to make sure that during your pregnancy, before, all of your, your health factors, your risk score check out really low. And then absolutely, that should be something you should dive into. But I think when you look into developing a birth plan and understanding how you envision the most important day of your life, and you come up with what you want on that day and how you vision that day and who do you want to be there and how do you want it to go, then that's going to allow you to open up doors of, well, where is the right place for me? Is the right place for me in a hospital, or maybe home is a better setting? And then you start doing your research as the midwives in your area that, can provide that birth to you, because that's what they're trained for. Midwives are trained to handle low risk women. And it's great because that's like all the equipment that we have, all the training that we do, all the support and the educating helps to get that great outcome that you want. And midwives are really good at picking up problems because we know what's normal and what shouldn't be there. And so when we see a problem, then we address it. And if we can't address it, then that's when it's time to, discuss about transferring to a higher level facility that can address it, and having that open communication with your provider so that they can communicate early on, this is what I see and I'm not liking it, and this is what's going on. Let's make a move. In that trust, it really helps so that even if it was low risk and suddenly it becomes high risk, everybody still comes out great in the end because of the proper care that they've been getting. And that starts off with, where are you wanting to birth? So come up with a birth plan, delve into your options of which one might be best for you, and then have the birth of your dreams. It's a beautiful day. It's a beautiful experience. Fear shouldn't stop you of the pain. When you're in the right setting, what you want, you can cope with anything. So good luck.